According to the research of the National Association of Anorexia and Associated Disorders, 62 million people of all ages from the United States suffer from the effects of eating disorders. Eating disorders are becoming more apparent in the United States, therefore the different types, the reasons behind the disorders, and the effects of eating disorders should not be neglected. There are a few types of eating disorders, and I have chosen to tell you about anorexia, bulimia, and binge eating disorders today. Anorexia is characterized by self-starvation and excessive weight loss. Some of the symptoms of anorexia is the refusal to maintain body weight at or above a minimally normal weight for height, body type, age, activity level, and the intense fear of weight gain. Bulimia, which centers around binging or purging of food. Bulimia includes eating excessive amounts of food in short periods of time, often in secret, then getting rid of that food and calories through vomiting or over-exercising. Binge eating disorder, also known as compulsive overeating, is characterized primarily by periods of compulsive, uncontrolled, continuous eating beyond the point of feeling comfortably full. Culture has been identified as one of the factors leading to the development of eating disorders. Rates of these disorders appear to vary among different cultures and to change across time as cultures evolve. Traditionally, eating disorders have been associated with Caucasian upper socioeconomic groups, but it seems that it is not the case anymore because other American ethnic groups also may have higher levels of eating disorders than previously recognized. A recent study of early adolescent girls found that Hispanic and Asian American girls showed greater body dissatisfaction than white girls. Cultural beliefs that may have protected ethnic groups against eating disorders may have eroded as adolescents acculturate to mainstream American culture. The effects on the individuals with eating disorders should not be neglected because some of the effects are severe. 33 to 50% of anorexia patients have a mood disorder, such as depression. Mood disorders are more common in binge and purge subtype than in restrictive subtype, leading to 1 in 5 anorexia deaths is by suicide. Some of the long-term effects of anorexia are infertility, shutdown of major body systems, brain damage, heart attacks, and ultimately death. Nearly half of bulimia patients have acquired a mood disorder, and more than half of the bulimia patients have anxiety disorders. The long-term effects for bulimia could be feeling faint, red eyes, dry skin, pregnancy problems, low sex drive, bloody vomit, face swelling, irregular heartbeat, tooth decay, and hemorrhoids. Nearly half of binge eating disorder patients have a mood disorder, and more than half of the patients have anxiety disorders. Almost 1 in 10 binge eating patients have a substance abuse disorder, usually alcohol. Some common long-term effects that go along with binge eating disorders are diabetes, high blood pressure, high cholesterol, gallbladder disease, heart disease, shortness of breath, certain types of cancer, menstrual problems, decreased mobility and tiredness, and sleeping problems. Culture is one of the main reasons behind eating disorders. Other cultures are wanting to mainstream into American cultures, and they are trying to do that by losing weight and looking like the models on the cover pages of magazines. Unfortunately, the effects on the individuals with the eating disorders have become problematic. Eating disorders are becoming more apparent in the United States, therefore the different types, the reasons behind the disorders, and the effects of eating disorders should not be neglected.